Difficulty swallowing is a very common problem that I see. The most common reason why people can have difficulty swallowing is called a stricture or a narrowing in that esophagus. And when patients complain about this, they complain that things get stuck like water or food. They have to choke, or they even have to use the restroom to vomit that food out. Let me tell you, this is never normal. You should not have this, but it's in a condition that we can fix. So in this video today, I'll explain exactly what we do when someone has a stricture or a narrowing. So in this video here, you can see that there is a stricture or a narrowing in that esophagus. Those rings that are there, and these rings are narrowings in the esophagus that can cause a stricture to occur. Now in this condition, this individual has a condition called EOE, eosinophilic esophagitis, which is an autoimmune disease in which your body actually attacks the esophagus to cause narrowing and stricturing to occur. These patients also have atopy, dry skin, even asthma as well. Most commonly, it's in young Caucasian men, but it can be in anybody. Now, because this patient was having trouble swallowing and I saw a narrowing in that esophagus, I wanted to find out why and also maybe stretch out the esophagus to get this fixed for this patient. So right now, I'm inserting what's called a balloon. That purple thing is a balloon that's there. It's basically a balloon to pop open that esophagus to allow this patient to swallow. And so you'll be seeing the balloon opening up. This is right here. We're inflating the balloon with water, and we're doing it where it's opening enough to allow the narrowing or the stricturing to occur. Now what this does, it actually breaks up the fibrosis of the esophagus, the scar tissue that's there, to allow this patient to swallow easier and to resolve the problems that are there. And we're going all up and down the esophagus to open up that narrowing. We typically leave it open for about a minute, which studies have shown this will give it enough time to break up any scar tissue that's there. Now, as we're doing this, we're fixing the immediate problem. We also want to find out why, so we may do further testing so we get down to the root cause of why this person has trouble swallowing. If you're having trouble swallowing, it's not normal. Come see someone like me so we can find out what's going on and get you feeling better.